physicians to have those conversations by reimbursing them for it.
Okay, let me play the devil's advocate a little bit, because I think for the doctors to get paid is absolutely the good thing. But a lot of doctors out there are really, when they hear the word Medicare, they get very upset because the patients' complex diseases are getting worse. Their patients are living longer. The number of medications they're on, it's growing. And the demand for Medicare patients are increasing. And yet the reimbursements for Medicare, if you look at that graph over the last 2 decades, has been going further and further down. And it's getting more difficult to take care of these Medicare patients. Is there anything in the pipeline to really change that or help doctors so they spend time with the patient and not rush and go through numbers rather than quality?
Well, look, you're not going to get any arguments from me on that. I think you're absolutely right. Medicare, of course, has been under reimbursing patients, particularly for, I think, what's called evaluation and management.
Yes.
So that's a critical part of the equation. You do want to encourage them to have those conversations. I think a lot of physicians, are kind of in almost like a patient mill situation where insurance, not just Medicare, but private insurance also, lowers reimbursements to the point of time where they're just trying to get the maximum number of patients through their practice in a day. And I know that's certainly true for primary care. And fewer physicians are actually participating in Medicare. In Manhattan, I know I hear this all the time. More and more physicians are dropping out of the program and just saying, I can't afford to take Medicare patients anymore. I think that's a legitimate concern. I'm not sure what the perfect solution is. I think we've got to think about a couple of things, one of which is I think insurers need to shift towards some kind of bundled payment system that rewards physicians for spending the most time and attention on their highest needs, most complex patients. I think that's absolutely right. And you need to think of ways for all of the people who are in the healthcare professional system to be practicing at the top of their license. So maybe a practitioner can do more and leave the physician with more time to focus on the complex cases and be appropriately rewarded for focusing on those complex cases. And for things like cancer, you were speaking a few minutes ago, and I had the pleasure of listening to your conversation. It's getting so much brighter, the outlook for cancer. You mentioned precision medicine. There are new immunotherapies. I'm sure you're acutely aware they're coming online. They're having really extraordinary results. They're also very expensive. So how do we set up a framework that rewards companies for bringing to market extremely effective treatments for cancer, and at the same time recognize that we can lower the cost of care by properly coordinating the course of care, eliminating, as you said, the expensive tests or diagnostics for patients who are not going to progress to life-threatening cancer, and delivering the best treatments possible for patients as early as possible who might develop metastatic cancer so that they never wind up in the hospital or in a nursing home or on a ventilator, and all those costs can go down. So I think that's a much more rational way for approaching the disease.
Well, good luck lowering the cost of the healthcare. That's going to be a very difficult one. And also, if you look at what's going on online, I had the pleasure of helping Julie Banderas, whose grandmother was actually stuck in Colombia. And we talk about telemedicine. I was fortunate to be able to talk almost FaceTime and talk to the doctors in Colombia, the country of Colombia, and exchange ideas about how we can improve her health. And while she got and received a great care over there, and the cost of healthcare is much lower over there than U.S., she wrote to me that, we still have the best healthcare in America and the access to healthcare and the type of technology that we have. So I think this is a great discussion, and I really appreciate your input in this, and thank you for coming today.
It's my pleasure. Thanks for having me on.
Thank you so much.